It's coming on. It's coming on. It's showtime. Go ahead, Kiki. Hi, everybody. Thank you for joining us. Thank you for coming on this evening, joining the Bold Influence group. I am so excited that you could come this evening. As you know, I love to say that we are going through the same pandemic differently. I love to always advocate for the disadvantaged groups, whether it comes from racism, classism, elitism, ableism, xenophobia, homophobia, all of that. I like to advocate for humans because I feel like everybody deserves a chance. Welcome to all of you that have joined us. Hi, Mato. I saw you comment. If I can just acknowledge God for this opportunity to share with you guys tonight. We are going to almost get started right away. So, tonight, this show is going to be talking about autism, how people with autism are faring through the pandemic. The pandemic, like I said before, highlights disparities that already existed in the system, that are still there, that are going to be there unless we do something different. Hi, welcome from Kenya. I see you. Thank you, everyone who has come on. And without further ado, I would like to invite my guest. Miss Jillian. First of all, before I do that, actually, I wanted to call out some numbers. But Miss Jillian, thank you for joining me. How are you this evening?
I'm good. I'm really excited to be here with you tonight.
Thank you. Welcome, Jillian Nelson. Jillian Nelson is a policy advocate and community outreach representative from Autism Society of Minnesota. And she's actually an adult living with autism. So she's basically speaking from the horse's mouth, and we can't wait to hear all the tips and things that she is going to teach us today. Having said that, I wanted to say that according to the CDC, 64 million people in America are living with disabilities. And that means it's 1 out of 4 adults, I'm talking about adults, that are living with disabilities in America, 26% of our population. That's a lot of people that I felt like were kind of ignored. And the reason I say that, Ms. Jillian, before you speak, is that thank you, all 25 of you that have joined us. I wanted to say that the CDC guidelines bothered me a little bit because I felt that a lot of communities were forgotten, whether it's from cultural perspective, disability perspective, whatever practices that people had. So people are having to make do with the little that they have. So I hear about this does not discount what's already in place. So let's make sure we are washing our hands for 20 seconds. Let's make sure that we are social distancing for 6 feet apart. Let's make sure we are wearing the cloth or face mask as tolerated as those who can make sure they're safe for them because we don't want to choke anyone. Let's also make sure that we are staying at home if we are sick. So, Miss Jillian, I'll let you speak on the autism numbers because I think that's your field, your specialty, your expertise. But who is Jillian Nelson?
I'm just me. I'm an autistic self-advocate that works for the Autism Society of Minnesota. It came into this community and this kind of became my passion work because I've dealt with some hard things throughout my life. And it's my goal to make sure that we can change the world and make it a better place and create a more accessible world. One thing that a lot of people don't think about when they think about disability, and like those numbers are already really, really gigantic and a lot to stomach, but the disability community is the only group of marginalized people that anybody can join at any second. So you can start one day, you can wake up in the morning, not have a disability, be living a perfectly average life with no struggles, no challenges, and then bam, one single event can happen unexpectedly, a car accident, a health incident, and all of a sudden you belong to that group. And it's so interesting to me as we think about society that how when we talk about things like the CDC planning, that's a group that often gets left out of those considerations, even though it's the only group that does not discriminate. Like it doesn't, we have people in every single country across the entire world that have disabilities, every single economic background that have disabilities, every single religion, every single identity. There are people with disabilities, yet we don't see enough of that planning. And that's kind of how I got to doing this, is that this is something that is going to theoretically impact a huge portion of our community at some point or another. And I'm stubborn and determined, and I just want to make the world more accessible for everyone.
I love that. And I think there's always this stereotype or notion that autistic people do not speak, or people with disability pretend to be something or to get attention, or about children in schools that have disabilities that are always disciplined for behaviors because they're acting out. So I think, how was Jillian growing up through all of this, and how did you get here? And thank you everybody who's joined us.
So I wasn't actually diagnosed autistic as a child. I was not diagnosed until I was 21. So I was one of those kids that was overlooked on that of everything I did. It was considered to be a behavioral challenge or a stubborn kid, or I was acting out, or I was being bad, when it was really meltdowns or anxiety or executive function challenges. I went through abusive relationships. I was abusing drugs. I was homeless on the streets. And I had a little brother, and he was about 5 years old at the time. And he was going through a lot of the same challenges I had gone through in school, except this was after they kind of understood that autism was a spectrum, not just the kid in the corner playing with the train that doesn't talk. So they assessed him for autism, and he was diagnosed. And the doctor that diagnosed him remembered treating me as a child. And I had a whole list of diagnoses. I was diagnosed with attention deficit hyperactivity disorder. I was diagnosed with depression. I was diagnosed with anxiety. I was diagnosed with borderline personality disorder and bipolar disorder and all these other things to try to explain this group of symptoms. And it wasn't actually until my brother was diagnosed that someone said, hey, maybe she has autism too. And that's what this whole collection of symptoms was. So sure enough, I went to find a specialist that could diagnose me, because this was 17 years ago, and there weren't a lot of specialists that were diagnosing adults for autism in 2003. So I did some hard work and found one, and that all of a sudden it explained everything about me. I always tell people that a diagnosis of autism as an adult, it doesn't actually change anything, it just explains everything.
I like that.
The whole world
change everything, but it explains everything. I like that.
You're still the same person you were when you woke up, but now you understand why you interact with the world so much differently.
And that's important to know. So I think for people listening, you can hear that if you have a child that is acting up, make sure that you're seeing a specialist who understands about behaviors, ideally a behavioral specialist. If you have a child who's probably having issues with speech, if you have some things that are not explained, it's always good to dig deeper so that you can find a reason for why things are the way they are. So with having all that, we know that coronavirus came up, there's an outbreak. And we can say that the CDC set guidelines for everybody to follow. And I have always felt like they forgot about a lot of communities. So for people with disability, especially in group homes, what is your take on it when we hear, like from New York or Italy, that people are having to choose between giving them a ventilator or not, Or one thing I read an article about people choosing to stay home, not go to the hospital, because they feel they have a fair chance of survival if they stayed at home than go to the hospital.
So medical resource discrimination is a really, really hot topic in the disability community right now. Most people, if you tell them that this is a topic and that it's something that people with disabilities are concerned about, they're like, oh, well, I don't understand why. That's not a thing that actually happens, is it? And then when we tell them that, yes, this is a thing that actually happens, I think the core of it, though, it really goes back even more than like the medical or coronavirus. And it's more this idea of the stigma that's still attached to having a disability. Oftentimes in our world, people with a disability, regardless of what that disability is, are treated as less than. Or it's assumed that the lives that we're living may don't have the same value as someone without a disability. So it may not have the same value as saving that person's life. And that's a really, really challenging thing. Like I look around at my peers in the community, in the disability community, and like other activists and the things that we're doing and the things that we have to contribute to the world. They're so amazing. I taught a class last summer and I worked with a young man in that class. It was a civic engagement class, so teaching students with disabilities how to change the world. And he doesn't speak, so he uses a device to speak. And if we were to sit down and like really measure, like and look at some of the standards they use in the healthcare community, like the tests that they'll do. One of the tests, forgive me, I can't remember the name. I'm sure you know as a nurse. It asks the question to decide like the life-saving measures to be taken. Is the person responding verbally? But we never account for what if that person isn't responding verbally on their best day.
I like that.
Like, yeah. How do we rate their life based on a standardized test that assumes that every single person in the world responds and communicates the exact same way? And that's not fair. Just because you live life differently from someone else doesn't mean that your life is any less valuable or
Right.
that you don't have just as much to offer the world as someone else.
I agree. And I think it's important to note that, yeah, we need to be more culturally inclined, or I call it cultural humility when it comes to people that we are interacting with. But someone may not be speaking, like you said, on their best day. What does that look like when they're in a crisis and you have to get a response from them? So that's very, very important. So for the parents who are actually preparing their children or homeschooling their children or trying to get ready for school, and then you see, oh, the CDC says when you're ready to go to school, or even just the young kids who need help to wash their hands, or social distancing when they need someone to push them in a wheelchair or to dress them. Like that's their day-to-day life. How do you feel these guidelines, and what resources do you have? Actually, the question is, what resources do you have for the parents who have children who are autistic?
So my biggest resource I have for parents without children who are autistic going through all of this is be kind to yourself. This is a giant change in routine. So the best thing you can do in getting through all of this is, first of all, just being kind to yourself and to your child. We're all going through a whole lot of change. I work for the Autism Society of Minnesota, and we're here. We're still open. We're not in the same building right now. We're all at our homes, but we're still here serving the community. And whether that's helping people find resources, like here's some tips and tricks that you can maybe use to help homeschool your kid, or here's a link to a music therapist we know that's still seeing people via video, or here's an article about how you can get some of that sensory input you were getting from occupational therapy in your home. Like, we're there and we're available to answer questions anytime and help people find the resources. We're also working with all of our teams, our event team and our counseling team and our camp team and our education team, to come up with a really cool summer of activities. I wish I could tell you exactly what it was, but we're still working on it because everything's still changing day by day, and we want to make sure that we're providing some really, really solid and interesting stuff to come up. And then we have virtual support groups right now. We have always held support groups. Previously, we held 5 support groups a month. Right now, we are conducting 4 support groups every single week because we understand that this is a really challenging time for our community. and that the same social outlets that were there before the pandemic aren't necessarily available right now. And we want to make sure that people have a chance to connect to people through our support groups. Also, I noticed in the comments that Nellie mentioned that our therapists are still working. All of our therapists are still working full time through telehealth. So, we're
So
also
I'm sorry. Are you saying that there's therapists like occupational speech therapy available through the Autism Society of Minnesota?
do not have occupational speech therapists on our staff. We work with traditional therapists that primarily see teenagers and adults on the spectrum. They do see some older kids, but we do also have a resource of people. So we do know of some therapists that are on the community that are still seeing people through telehealth, and we're happy to help people connect with those people.
I like that. So, having said that, I think there's something that you mentioned that was important one time when you and I were speaking, that you do have virtual groups that you meet with people, and then what about children that are nonverbal? How can you teach them? Like, just give me an example of how you can teach them about following the guidelines of COVID right now. So not necessarily doing exactly that, but you and I have talked about this, where how do you teach them? How do you show them? Having a routine, like, that's important.
I think there's a couple things we can do to help teach children that have more significant communication delays. One of my favorite tools is using something called social narratives. A social narrative is a story that's written with a very, very specific kind of language. It's prescriptive language, so it gives the expectation of what needs to happen. And if we review those stories with an individual with communication challenges, it helps set those expectations of, like, these are the steps we're going to take to wash our hands. These are the things that are going to happen when we leave the house. So it might say something like, right now, there is a virus living in our community. When we go to the grocery store, we will wear a cloth mask. When we go to the grocery store, we will keep our hands in our pockets and not touch anything. When we leave the grocery store, we will wash our hands and wipe down all of the fruit and vegetables that we brought home before putting it in the fridge. So it gives those expectations. The other thing we can use is visual scheduling. So we can make these little cards that have a very clear symbol on it that gives the expectation of this is what is expected. A good friend of mine actually has a ring of cards that she keeps in her shower that walks her through every single step in taking a shower.
Wow.
So that she can flip them over as she goes through those steps. So we can also use those tools to teach just about anything. So we can have those steps on the back of our kitchen sink to walk someone that might need that support through washing their hands. We can have a set of them by the front door to make sure that we remember our mask, our hand sanitizer, and our gloves before we go to the grocery store. So just building in some really simple tools. And chances are that kids with autism that need that level of support, these are the exact same tools they've probably been using at school. So bringing those into the home and the community right now would actually provide a great deal of relief and familiarity to a routine that's been lost right now.
And routine is very important to you, and I know that for these children. So having said that, you do a lot of work with advocacy and policy. Policy advocacy is what I really should call it. So with the Department of Health, the Department of Human Services, with your work at Autism Society of Minnesota, what resources then do you have, or what guidance or guidelines do you want to share with the public that they can support community?
The biggest thing I would like to share with the public is, if there's something on your mind, if things are hard right now, if you're having a challenge in your life with your child or with yourself, please call the Autism Society. Let us know. Even if we don't have an immediate fix, we're in meetings with a lot of different groups. So we are regularly meeting with the Department of Human Services. We're regularly being consulted with by the Minnesota Department of Health. We have connections with the Minnesota Department of Education. We're in regular communication with our senators and our representatives and even our governor's office. But we only know what's happening in our community if you tell us. So like this past week, we found out that there were some challenges in getting some of the telehealth therapies covered, like music therapy. But because some of our community members brought it to us, we were able to work with DHS and with other community advocates and help get that corrected so that people are able to access that. But the most important tool that any advocacy organization has is the community. So if we don't know it's happening out there, if we don't know it's challenging for you, we
Right,
don't know that we need to fix it. So
right,
you
right,
guys are actually my best tool, and we would love to connect. And then when you reach out and say, hey, can you help us with this? We also sometimes reach out in return and say, hey, this is happening. We're trying to get the lawmakers to make this decision. This is why this decision is important to the autism community. Please call them and tell them. Because the number one most important thing in any legislative process is our voices.
right.
You have to remember that up on Capitol Hill, like they do have a lot of power, but their power comes from us, and what we think and what we need from them really does matter to them. So, and I'm always here to help anyone that wants to get more involved and teach them that process and how they can reach out to their representatives and senators and start to tell their story and be heard.
So I'm going to challenge you a little bit, and thank you for sharing that about advocacy. And I'm sure you're always taking volunteers, people to work with. As an African woman or East African woman, there's always this stigma, or in our community, there's not even a term for autism. We don't have a name for it. So as you know, the Twin Cities, we have a lot of African immigrant parents here, and there's a huge prevalence of autism in the East African community. So my question to you is, from a cultural perspective, what resources do you have? Do you have an outreach, a liaison, or how do we get into our communities to share your work and how you can support these parents that are already stigmatized by where we come from?
So we have an absolutely fantastic multicultural outreach specialist. Her name is Ashwak. She's actually been working really, really closely within the African communities here in Minnesota to try to do some outreach and bring some of the information that the Autism Society has into those communities. We always welcome more people. If you want to talk with her, just reach out to me. I'll get you in touch with her. She's absolutely amazing. And we welcome feedback from everyone. Well, the number one thing we want at the Autism Society is for all of our programs to be accessible. So this year, like even planning our conference, which we didn't get to have in person, but our conference was during Ramadan. So we put a lot of focus and time thinking about, well, how do we make this accessible for people that may be fasting or may have different prayer needs during an all-day conference? So we want to hear from the community. Like we don't know unless you tell us what kind of accommodations and accessibility we need. So I think the biggest thing for parents is let us know what you need. Let us know how we can help, because we want to help. And I firmly live my life by the idea of when we know better, we do better.
That's right. That's Maya Angelou. I agree with you. When we know better, we do better. So
ways. Like our job is to teach people about autism, so so that parents can be better parents and teachers can be better teachers and self-advocates can advocate for themselves. But we're on the other side, that we want to know from other communities how we can best support you.
I agree. And I think I love that for a leadership nugget. When we know better, we do better. I just want to make sure I didn't miss any questions from the public. I see Chloe's commenting. I love the community. Adults too here. Day programs are closed, which is unfortunate. There's a lot of places that are closed. There's a lot of elective appointments that are closed. Hopefully we can get over this pandemic soon so that people can go back to getting therapy, getting those social interactions. But in the meantime, we have to make sure that we keep everybody safe. For that, do you have any closing remarks? Because our show is done.
I'm just so excited that everyone came out to talk with us tonight, because it is the whole pandemic is challenging for everyone. Then you throw adding a disability in there, and it's a whole new world.
Right?
But I also think that something really beautiful that can come out of this really, really challenging time is a lot of the things that are happening all over the country and all over the world now, like these virtual access, working from home, figuring out how to accommodate safety needs. These are a lot of the things that the general disability community has been asking for in terms of accessibility. And the world has always been like, oh, well, we can't do that. We can't do things virtually. We have to be in the same place. So as we're doing this, we're learning a lot about how to create a more accessible world. And I'm so excited to get back to the day where we can all sit next to each other and have these conversations in the same room. But I also love that we're creating a new pathway to accessibility for people that aren't always able to be in the same room. whether it's because of transportation or sensory challenges or health issues or distance. So I'm hopeful that out of all of this, we can build a more inclusive world for everyone.
There's one question for you. If you have any connections or resources for people in New Jersey.
Rose, reach out to me and I can get you in touch with some individuals at the New Jersey Autism Society. They can help you locate some resources that are local to you.
Awesome. So you can inbox Jillian or myself and we can get you that going. Let me just make sure I did not miss anybody his questions. I think this is amazing. But I want to thank everybody that came out tonight. Like Miss Jillian said, thank you for spending your evening with us. Thank you, Jillian, for sharing your story. And it's actually a lot of hope for a lot of people that just see autism as doom and gloom. It's nice to see that there's actually an advocate who's gone through autism, who's actually an autistic adult, who can actually say, oh, I'm here to support you. I'm here to fight for you. So I think that's encouraging to hear. And next week, I think on Wednesday, everybody, I'm inviting you to come see Eunice Menja. We shall be talking about poverty and COVID-19. So let's hear more stories and see how disadvantaged groups are affected with COVID-19. On that note, thank you, Miss Jillian, again for joining me, and let's stay in touch. And anybody that has questions about autism, please inbox me or Jillian. Thank you
And
for that.
stay safe and stay healthy.
Yes, stay safe and stay healthy, and God bless you. Bye.
Bye.